Welcome back once again. With us live over the phone is Professor Dr. Amr Mabrouk, professor at Ain Shams Faculty of Medicine, University. Good morning, Dr. Amr Mabrouk. Hello? Hello? Dr. Mabrouk, are you with us? Are you there? Hello? I'm afraid we are losing Dr. Mabrouk. We're supposed to be in contact with Dr. Mabrouk. He's a professor of medicine at Ain Shams University. And actually, of course, the fact that... Hello? Hello? Dr. Mabrouk, are you there?
Yes, I can listen to you clearly.
Good morning, Dr. Mabrouk.
Good morning, how are you?
Thank you so much talking to us on the Breakfast Show. But just observing this very important healthcare event, this is the largest and most important healthcare event probably on the African continent. And this definitely strengthens Egypt's position as a leading regional healthcare hub in Africa, of course.
Of course, Egypt has been always one of the pioneer countries in the field of medicine, and Egypt has always extended assistance and help to the whole of Africa since many years back. As a source of not just only helping with sending physicians or doctors, but also with helping with giving out great care, education, and nursing, and every possible measure of helping our neighbors in Africa.
Okay, this edition is the fourth one on the row. So the theme for this edition is innovation, independence, harnessing artificial intelligence and local manufacturing to strengthen African health system. So it's very obvious that AI is very much involved even in medicine and healthcare spheres. So what is the fourth edition adding to this expo? If I could kindly ask you to lower the volume of your TV set, please.
I'm not putting on my TV.
There is an echo. But anyway, so...
I'm not putting on my TV.
Okay.
I'm not putting on my TV.
Sure. So, Dr. Mabrouk, what exactly is the fourth edition adding to this very important healthcare expo, especially that AI is very much involved? Talk to us about the role of artificial intelligence, even in medicine. It is believed now that through artificial intelligence you can operate a full surgical operation on distance. So talk to us about the role of artificial intelligence and what have the fourth edition added to this expo.
Well, I beg to differ as to say that we can do a surgery on artificial intelligence on a distance way. This could be a bit over-exaggeration because we need the human factor. One of the only fields in the world that human presence is very important is the field of healthcare. And that's why whenever we look at what's going around in all over the world, where a lot of jobs are becoming extinct and replaced by computers, the only job that has been always present is the healthcare. The healthcare, by the presence of a human being, is very, very important. And that's what Egypt is concentrating on. The fact of the artificial intelligence as a source of help, as a source of delivering information, as a source of helping, taking the decision that can differ between life and death is very important. But the human factor is the most important of. And of course, we can help in diagnosis. We can help in reading reports and writing reports of distance, far away X-rays and CT scans and types like this. But to do a surgery, the human being has to be there. Even if he is operating distant operators, he is the one who's making the decision, because the variability in the anatomy and the structures of a human being varies from one person to another, which cannot be put easily in a multiple choice. But the role of artificial intelligence and its role in what is going on in this important conference is very important, because this helps in the exchange of information, in the spread of knowledge, in the conformability. And that's why I was very happy that a lot of the communication companies and in the field of communication are also taking part in this and signing contracts with our partners and elevating the partnership between Egypt and the African nations to strategic partnership, which goes on far away, not just by the transferability of experience and expertise, but also by the very far-fetched away and distant places where we can help in diagnosis and help in doing the first primary aid.
Right. It's so good that you kindly mentioned that no matter artificial intelligence is becoming so popular, so advanced, so spread, so involved in many spheres, still the human factor takes the lead. But then observing the role of artificial intelligence, it's still very important when it comes to, for example, in the sense of assessment of a critical situation at a very critical or short time where the human factor really has a full hand in a surgical operation, in a bit of a process, a difficult process that needs the involvement of a human factor, but at the same time needs the assistance and the speed of an artificial intelligence factor. So if you'd like to explain to us how important or what exactly could be the best use of artificial intelligence to the human factor, especially in the medical field.
In planning, this is very important, because once a patient comes, we can have a help of artificial intelligence in reaching the proper diagnosis, in narrowing the field of the final diagnosis, and therefore reducing the time that we take to reach a diagnosis of a case. This can really help in reducing the number of human beings involved. But in the end, the only decision maker will not be the computer. It will be the human being based on his own experience, which matches with the difference, as I told you before, how far are we going to reach in the diagnosis and how far, what type of procedure that we are going to do. Artificial intelligence can help us to reach that. What is important in the artificial intelligence as well, connected thoroughly through advanced communications of the 5G and 4G, is that we can diagnose and write reports of X-rays and of CT scans and of reaching a diagnosis and making consultation on distant, far away places that can help in giving the steps to a less experienced physician on the end of the modem. But this less experienced physician has always limited capabilities, but his role in saving the life is indispensable.
Right. So, of course, the fourth edition came with a package of the latest state-of-the-art new innovations and researches that could be able to effect significant differences in the medical field. What exactly is the fourth edition bringing to Africa when it comes to the latest medical innovations, the latest techniques, and the latest probably medical researches in a very critical, a disease like chronic disease, like very complicated surgical operations, like, for example, very decisive surgical operations like plastic surgeries and all that?
Well, I like the idea very much that what happened in the conference was not just medical research presentations, but it was clinical and scientific sessions, and also a lot of agreements that were made between different companies and going into the field of ideas and innovations and manufacturing state-of-art equipment that can be exported to our neighbors in Africa, and this is very important. The other fields that can really of help, I found that there are sessions about cardiology and cardiac surgery and a lot of things that can really be a source of enlightenment. So it's not just technical, it's not just industrial, but it is scientific and research exchange. Of course, in the field of plastic surgery, which is my field as a professor of plastic surgery, there are a lot of things to be mentioned, but the plastic surgery is one of the very important fields where the human touch is very, very important. We don't only deal with the common sense of making the people beautiful, but also for reconstructions and post-trauma and post-burns fields, which are becoming very much advanced as regards the types of the dressings and the types of replacements that we are having, where technology goes hand in hand with the experience and the expertise.
Many people might think that plastic surgeries are a luxury process that only rich people attain to request. But in reality, plastic surgery is very important and essential to some chronic or innate disease or some sort of complications that babies are sometimes born with or humans are born with. It might be a cure to some critical problems or accidents that might be very harmful to people and so on. Explain how have this conference been able to reflect the true image of some sectors of the medical process that there is a misconception brought about it by people?
There are about 6 branches that are enrolled under the umbrella of plastic surgery. Plastic surgery is the reconstruction after trauma, the reconstruction after congenital anomalies like you have just said, like cleft lip and palate, and of course the post-burn and the burn management, and of course the post-tumor extractions, like for example removal of tumors or skin tumors. All this needs reconstruction. Plastic surgery is one of the newest, oldest fields. It started to be organized almost 108 years ago in 1917 with the World War I, with the work of Harold Gillis, who was a New Zealander surgeon who started his service in the British Army. At the time of World War I, we had a lot of injuries, of maxillofacial injuries, the fractures of face.
Right.
And after that, the field has gone more progressive. In Egypt, we have one of the oldest societies of plastic surgeons that was inaugurated in the year 1962 by my father, the late Professor Mabrouk. He was a general in the army, and Professor Al-Bahiri from Cairo University, and Professor Nadir Suwaylam from Ain Shams. The 3 of these pioneers gathered to build up the Society of Egyptian Society of Plastic Surgeons, one of the oldest societies in the world, where yearly conferences and state-of-art papers and research work is made and presented every year in different courses all over Egypt and all over the world, representing Egypt. And Egypt has got a lot of research work with a lot of international citations of this work. The advance that we have seen in technology and the convoys of Egyptian plastic surgeons who are going not only through the whole of Egyptian governorates, but all through Africa since very long time. I remember that I was involved in the 90s with a convoy that went to Kenya after the explosion of the American embassy over there, where we treated victims of this explosion. And we did, in 2 days, about 30 operations of plastic surgery. And it was a convoy of a lot of experts and experienced plastic surgeons. Also, in Sudan and Libya and all over the whole world of Africa, we have seen how the Egyptian plastic surgeons have been going there, doing their work, and silently acting as heroes behind the scene, how to treat congenital anomalies like cleft lip and palate, and management of burns and scars, and helping to soothe the pains of the human beings.
Right. So to what extent does the conference really help in supporting local and joint pharmaceutical industries across African countries?
There has been a lot of agreements, and I found out that the Arab Organization of Industries has signed a lot of treaties with different African companies in order to have partnership in building a lot of and manufacturing a lot of machines and equipment that will help in definitely presenting a very good service. And also the connection and communications through the Egyptian communication companies, whether this for abroad or for doing the teleconferences. Also, this is another thought of what was presented during this conference. The pharmaceutical companies, the Egyptian pharmaceutical companies, which are pioneers in the field of medicine since the 30s and 40s of the last century, have had a great role, and now to be authorized to work in Africa limitless without borders is definitely a very great step further to increase the fraternity between our countries, our country and the African continent as a whole.
Right. On this note, Professor Dr. Amr Mabrouk at Ain Shams University would like to thank you so much talking to us on the Breakfast Show. And we're going to go to a short break and we'll come to continue the show, so stay with us.